like most about the MPTC Nursing program is that you start with your prerequisites and you get right into the nursing program. Most clinical agencies absolutely love our students because they're here to work and work hard, and they're out in the communities making a difference for everybody. And then we have concurrent enrollment with four-year universities. So if students do want to continue on in the nursing program and get their bachelor's, we have an opportunity and we partner with schools for that as well.
As a faculty member, I get to work with all of you. And you come from various walks of life. I learned from you as much as you learn from me. We laugh and we joke. There's even times that we cry. Proudest moment that I have is when I get to see you guys all graduate and then you start to share what you know with the new nurses coming in.
It's coming home because I am a grad of Moraine Park. I started my career here and it feels very natural to end my career here. I love taking care of patients and I love that I still get that opportunity to go to the bedside during clinicals and take nursing students there. Students can best prepare themselves for the first semester of the nursing program by taking into account their score on the HESI exam and then seeking out help and remediation if they scored less than a 75% on any part of it.
They can actually use the Student Success Center as well, work with them. They'll be able to help you out a lot.
Review their anatomy and physiology classes that they took already to get into the program. They should make sure that they are ready to study really hard. Lots of reading is involved, lots of time on campus, in class, and then there's a lot of outside effort as well.
And they'll need to brush up on their basic math so they can apply it to medication administration and to safe patient care.
Students will have to make sure that they're prepared with all the supplies on the supply list that they need for each class and for each clinical.
Students in the nursing program will be taking their exams on iPads so that we can simulate the NCLEX experience to really make them comfortable with testing on technology.
And they can expect a math test in every clinical experience and also in their basic skills class in that first semester.
Students can best prepare for the nursing program by also having a plan in place for their personal life, especially when it comes to child care or care of anybody else, so that they have time set aside so that they can be successful in the program.
Set up expectations and also set up time that you can spend with your family as well, so that they know that that's the time that they can approach you and that you're available to them. It's going to be a change. It's not just you going to college. It's everything in your life is going to change. You're going to have to say no to some things. You're going to have to maybe miss some of the activities that you once did. Or you might be at those activities with your computer in tow.
Making sure that they take time off from work, maybe cut back on their hours. So using PTO and vacation is important because a lot of students are already working full-time and they have family, and so to find that work-life balance can be very challenging.
It's going to be probably unlike any other thing that you've done because you've taken a bunch of little pieces to prepare moving forward, and now all of a sudden you're having to pull back from what did you learn in anatomy and physiology? What did I learn from psych?
In the first 8 weeks of the program, there's a basic skills class where you learn all of the basic nursing skills. Then the second 8 weeks, you'll have your first clinical experience, and it'll be your first opportunity to perform a full head-to-toe assessment, complete a care plan for a patient, and then come up with the first diagnoses for your patient.
So they will be learning simple things as far as wound care management and how to pass those first medications and how to make sure that they do it safely. They can also expect for a large volume of work as they are entering the program. We really need to make sure that they have a good basis so that they can enter clinical safely.
You will have clinical experiences that will be throughout every semester, and they could be on days, they could be on PMs or evenings. So it's important to recognize that you could have clinicals on any of the different shifts, and that every semester it's a different clinical experience, so it will depend on where you're going. When you join the nursing program, you'll join with a group of students that we refer to as your cohort, and you have a cohort on every campus. And there's 16 to 24 students that you'll be with throughout the nursing program. And it's important to make friends in that cohort, to build relationships, because those will become some of your best friends, and also your best study partners because they're going through the same thing that you're going through.
Students are also joining a great club of people who are entering healthcare during unprecedented times, and we're all here to take care of people. The relationships that you form here at Moraine embark in the nursing program can last a lifetime.
Get excited about nursing, get excited about your career, and really get involved and be in as many nursing association and clubs that you can, and also meet with those people regularly to study so that you don't get overwhelmed, and that can also be a good stress reliever. We've started incorporating different forms of technology into the nursing program. Our simulation center in West Bend was built over 10 years ago. Now we have one in Beaver Dam, and we're hoping to get one in Fond du Lac. We incorporate simulation and technology into every clinical course. Every theory will also have a simulation attached to it.
The simulation center allows us to have clinical scenarios that kind of align as students might encounter in the real either acute care setting, which is the hospital setting, or in a nursing home setting, that we have scenarios created that are kind of leveled, and they have them throughout all 4 semesters. And with those scenarios, we can have students come into our simulation center and simulate a patient experience by using these high fidelity simulators. We can have patients dropping their blood pressure, increase their heart rate, and then we are looking to foster clinical reasoning and critical thinking in our students by having them do interventions to help counteract what they're seeing in their patient. So students are really able to learn in a very controlled environment and not be worried about the repercussions. They can make mistakes, that's okay, because this is a safe environment for them to learn in. The anatomy table, it's just amazing how they fit all that technology into this interactive table.
So we have virtual reality headset that students can wear and be into a hospital environment and perform skills on seemingly lifelike patients.
The nursing program has sure evolved, and that is really evident by the simulation center that we're standing in right now, and being able to integrate collaborative simulations with EMS and respiratory therapies, and eventually with medical assistant and CNA programs.
From time to time, there's going to be days that you aren't as successful as you would like to be, and it's okay. And what I really want you to do is just take a breath when that happens, reach out to your instructor, reach out to your peers, and get their support and regroup and figure out how to move forward. At the end of the day, we want you to be successful, and we don't know if you're struggling, so please let your instructor know that. You should be going on with an A or a B and feeling good about yourself, and we want you to feel good with all those successes that you have. We also know that you might be feeling just a little stressed, so figure out ahead of time what are the things that you can do to relieve stress. Maybe go for walks, maybe exercise, maybe spending time with your family. I think one of the things that I talk to my 4th semester students that they say is that they kind of forgot how to exercise. So work on taking time to be good with yourself. I know that the hospitals around us and the clinics, the nursing homes, they are looking for our students in particular, because they know that you've not only had a really wonderful experience here, but that you are so well prepared and that you're able to function from the get-go.
A piece of advice I would want to share with incoming nursing students is that if you are struggling and if you are getting behind and if you're not quite understanding something, you need to reach out to your instructor and you need to do it right away so that we can help you, because we really do want you to be successful. The knowledge you get at the baseline, we build on that throughout the program. So we really need to make sure that you understand concepts right away.
I've always known that I wanted to be a nurse. When I was young, I remember thinking that I wanted to help people when I got older, and I wanted to help them in their sickest moments and when they really needed someone, so that kindness and compassion. And I always wanted to be a teacher, and I couldn't decide between the two, so I decided to put them together and become a nurse teacher. And I love working with students. I love helping them, and when they finally understand or get it with that critical thinking, that gives me great satisfaction.
I have been a nurse for 38 years now, And the thing that was most intriguing to me, the assortment of different things that I could do as a nurse. I've been a teacher, which I am now. I have worked in a trauma center. I've worked in an emergency room. I've worked in hospice care. So I've had a wide variety of different things that I've done. And I think that's what makes nursing so exciting, is that you have multiple opportunities, no matter what your background is.
We as nurses have this unique ability to be with someone when they're born, be with someone when they're sick, be with someone when they have surgery, and we get to be with people. It's a great honor to be with people at the end of their life. So I enjoy the journey.
I am an alum of Moraine Park. This is kind of surreal to come back and to be able to teach in the program and share my passion and my learning with upcoming professional nurses. Don't hesitate to follow your dream. I mean, nursing is a wonderful profession.
And I love that here at Moraine Park, my students are now kind of my patients. I really do believe in relationship-based care. It's a nursing theory by Jean Watson, how having caring moments with people increases their positive outcomes, and it just transcends the bedside, and it is a catalyst for success.